The National Health Service is getting better.
We made the decision that the NHS was special.
The NHS.
The NHS.
The National Health Service.
The NHS is under pressure in every part of the United Kingdom.
It's a question that keeps being asked. How do we solve the ongoing crisis in the NHS? What can be done to fix it? This is a big question, and one which has potentially many answers. There are some big challenges facing the NHS today. The number of beds it has available for patients. Is the money being invested in the health service going to the right places? We have an ageing population and a broken social care system. There are workforce pressures, including recruitment and retention, the low staff morale, and the care and welfare of healthcare staff. The pressures on mental health services, and a backlog that has been turbocharged by the COVID-19 pandemic.
999 mode.
Ultimately, it comes down to this. What does the public need the NHS to be, and is it offering the level of service required? If not, how can it? Again, huge questions with no simple answers.
Thank you for having me. Oh, thank you.
The government says that the NHS needs reform. Prime Minister Rishi Sunak made reducing the NHS waiting list one of his key pledges for the next couple of years. Back in November 2022, Health Secretary Steve Barclay also outlined 5 priorities in the short term for the NHS. They were employing more staff for NHS 111 and 999, focusing on urgent and emergency care, tackling delays in discharge from hospital, improving access to primary care, and investing in technology to help. Labour's shadow Health Secretary Wes Streeting recently has had some strong words to say about the National Health Service.
The NHS is in crisis, the biggest crisis in its history.
He said the NHS was in existential crisis and pledged his party would train more staff, use the private sector to bring down waiting lists, and introduce fair pay and conditions for workers.
It will have 3 definites and 2 possible discharges.
There was once a time when politicians claimed the NHS was the envy of the world. That doesn't seem to be the case anymore, and people are looking overseas for answers to this crisis.
We want Scandinavian quality alongside Singaporean efficiency.
So what does this mean? Some people want to follow some European health models where patients pay some money towards treatment. The former Health Secretary Sajid Javid says some patients should pay to see their GP or for ED visits. But others, like the former Labour leader Gordon Brown, warn that this would create a 2-tier health system where the poorest would be worst off. This is not a new conversation. People have been talking about NHS reform for nearly as long as the service has been around. But it is struggling more now than it has ever been, and no short-term solutions are going to fix it. Long-term, well-funded planning is needed, something that has been difficult to guarantee in these turbulent political times.